Margaret is 71 years old. She lives alone in Ohio. 3 weeks ago, she had a fall. Her doctor said she needed an MRI on her hip. Her Medicare Advantage plan said no. The letter said her request did not meet medical necessity criteria. Margaret read that letter. She felt confused. She felt scared. And she did what millions of seniors do every single year. She gave up. She never filed an appeal. She paid for the MRI out of her own pocket. $1,400 from a savings account that was already running thin. But here is what Margaret did not know. If she had filed that appeal, she had an 80% chance of winning. 80% of appeals are overturned, but only 11.5% of seniors ever appeal. Margaret never even tried. I am Edward. I am a senior policy analyst, and I have spent years helping retirees understand the rules that affect their health coverage, their finances, and their peace of mind. Today, I am going to break down one of the biggest problems facing seniors in America right now. Your Medicare Advantage plan can deny your care, and most of the time, that denial is wrong. But they are counting on you not knowing that. They are counting on you not fighting back. In this video, I am going to show you the exact government data that proves how often these denials get overturned. I am going to explain your legal rights in plain, simple English. And I am going to give you a 3-step action plan you can follow starting today. But please stay with me until the very end, because there is a hidden trap that almost nobody talks about. It involves what happens when a wrongful denial turns into a debt on your credit report, and it is affecting millions of seniors right now. Let me start with a story. Robert is 67 years old. He retired 2 years ago from a manufacturing job in Michigan. He has a Medicare Advantage plan through one of the large national insurers. He picked it because the premium was $0 a month and it included dental and vision. It seemed like a great deal. Last November, Robert had a minor stroke. He was admitted to the hospital. After 5 days, his doctor said he needed to transfer to a skilled nursing facility for rehabilitation, physical therapy, occupational therapy, the kind of care that helps a stroke patient learn to walk again, to dress himself again, to live independently again. His Medicare Advantage plan approved the first 10 days, but on day 11, Robert received a notice. The plan said he was ready to be discharged. Robert's daughter called the facility. She called the insurance company. Everyone told her the same thing. The plan made its decision. Robert had to leave. What nobody told Robert's daughter is that she had exactly 48 hours to file an appeal. Nobody explained the process. Nobody handed her a form. And by the time she found out about the deadline, it had already passed. 48 hours. That is all the time you have to appeal a hospital or facility discharge. Robert went home too early. Within 2 weeks, he had another fall. He ended up back in the emergency room. Now, here is the part that should make you angry. The U.S. Senate investigated the 3 largest Medicare Advantage insurers. They found that one of them increased its denial rate for skilled nursing facility stays by 900% in just 3 years, after it started using automated technology to review claims. The Senate report said these companies intentionally use prior authorization to boost profits by denying post-acute care. Robert's denial was not a medical decision, it was a financial one. And the system was designed so that Robert would never fight back. But the law is actually on Robert's side, and it is on your side too. Let me show you exactly what the government's own data says. Let me start with the most important number you will hear today. In 2024, Medicare Advantage insurers received nearly 53 million prior authorization requests. These are requests from your doctor asking your insurance plan to approve a treatment, a test, a procedure, or a hospital stay before you receive it. Out of those 53 million requests, 4.1 million were denied. That is 7.7%. Now, 4.1 million might sound like a small percentage, but those are not numbers on a page. Those are real people. That is someone's MRI, someone's chemotherapy, someone's rehabilitation after a hip replacement. And here is what the insurance companies do not want you to know. Of those 4.1 million denials, only 11.5% were appealed. That means roughly 88% of seniors who got denied just accepted it. They walked away, they paid out of pocket, or they simply went without the care their doctor ordered. But among the seniors who did appeal, 80.7% had their denials overturned, either fully or partially. Let me say that again. 8 out of 10 appeals were successful. And this is not a fluke. The Kaiser Family Foundation analyzed this data going back to 2019. Every single year, more than 80% of appeals have been overturned. Every single year. That means the original denial was wrong the majority of the time. The care was medically necessary. The documentation was there. The insurer just said no anyway. Now, why does this happen? The Health and Human Services Office of Inspector General investigated this directly. They reviewed hundreds of real denials from the 15 largest Medicare Advantage companies, and they found two things. First, 13% of prior authorization denials met Medicare's own coverage rules. That means those services would have been approved under original Medicare. The insurance company applied stricter rules than Medicare allows. For example, requiring an X-ray before approving an MRI, even when Medicare does not require that step. Second, 18% of payment denials met both Medicare's rules and the plan's own billing rules. These were denied because of human error. A reviewer overlooked a document. A computer system was not programmed correctly. This is not a broken system. This is a system that is working exactly as designed. The insurance company says no. Most people accept it. The company saves money, and the senior pays the price. But federal law says you do not have to accept it. Under federal law, every Medicare beneficiary has the right to a 5-level appeal process. This is published directly on Medicare.gov. Let me walk you through it. Level 1. You ask your Medicare Advantage plan to reconsider. You have 65 days from the date on your denial letter to file this appeal. The plan has 30 days to respond for services you have not received yet, or 60 days for payment disputes. If your health is at risk, you can ask for a fast appeal, and they must respond within 72 hours. Level 2. If the plan says no again, here is the part most people do not know. Your case is automatically sent to an independent review entity. This organization works for Medicare, not for your insurance company. You do not have to do anything extra for this to happen. It happens by law. If your plan denies your Level 1 appeal, the case is automatically sent to an independent reviewer. You do not need to take any action for that to happen. The law requires it. Level 3 is a hearing before an administrative law judge. Level 4 is the Medicare Appeals Council. And Level 5 goes all the way to federal court. Most seniors will never need to go past Level 2 because the data shows that the majority of appeals are won early in the process. Now let me tell you about an important change that took effect this year. As of January 1st, 2026, new federal rules require Medicare Advantage plans to respond to standard prior authorization requests within 7 calendar days. That is down from 14 days under the old rules. Plans must now give you a specific written reason for any denial. And for the first time, plans must publicly post their approval rates, denial rates, and appeal overturn rates on their own websites. This is a big deal because now you can actually look up how often your plan denies claims before you sign up for it. And you can use their own denial reason to build a stronger appeal. But there is one more thing I need to warn you about. And this is the part that most people miss entirely. If your claim is denied and you do not appeal, that unpaid bill does not just disappear. The provider can send it to a debt collector, and that debt can end up on your credit report. The Consumer Financial Protection Bureau found that nearly 4 million adults over 65 had unpaid medical bills totaling $53.8 billion, even though 98% of them had health insurance. In more than half of the CFPB complaints involving Medicare, the debt was reported as inaccurate. Almost $8 billion in medical collections sitting on the credit reports of over 5 million seniors. Many of those bills started as a wrongful denial that nobody appealed. Now let me give you 3 specific steps you can take right now to protect yourself. Step 1. Never accept a denial without filing an appeal. The moment you receive a denial letter, read it carefully. Look for the reason they gave. Under the new 2026 rules, they are required to give you a specific reason in writing. Then contact your doctor's office. Ask them to support your appeal with a letter explaining why the treatment is medically necessary. You have 65 days to file your Level 1 appeal. Write down the date you received the denial letter and mark your calendar. If you are in a hospital and they say you are being discharged too early, do not wait. You have only 48 hours. Ask for the document titled "An Important Message from Medicare About Your Rights." Call the Quality Improvement Organization number listed on that form immediately. Step 2. Call for free help. You do not have to do this alone. There are free government-funded programs designed specifically to help you. Write these numbers down or save them in your phone right now. Your State Health Insurance Assistance Program. Call 877-839-2675. They will connect you to a free counselor in your state who can walk you through the entire appeal process. The Medicare Rights Center has a free national helpline. Call 800-333-4114. And of course, you can always call 1-800-MEDICARE. That is 1-800-633-4227. You can also designate a family member, a friend, or a lawyer to handle the appeal for you. Medicare has an official form called the Authorization to Disclose Personal Health Information. Ask your SHIP counselor to help you fill it out. Step 3. Check your plan's denial record and protect your credit. Under the new 2026 rules, your Medicare Advantage plan is now required to publish its prior authorization denial rates and appeal overturn rates on its website. Look up your plan. If you see a denial rate above 10% or an overturn rate above 80%, that tells you something important. It tells you the plan is routinely denying care that should be approved. And if you have any unpaid medical bills that you believe are wrong, do not ignore them. Do not assume they will go away. Dispute them in writing with the provider, the insurance company, and any collection agency that contacts you. Never pay a bill you believe is inaccurate until the dispute is resolved. The CFPB says you have the right to challenge these debts, and medical debt should not destroy your credit. Now, before I let you go, I need to tell you something important. The rules that affect your Medicare, your Social Security, your pension, and your insurance are changing all the time. Right now in 2026, we are seeing hospitals drop Medicare Advantage plans across the country. 19 major health systems have already done it this year, including Mayo Clinic. Nearly 3 million seniors were forced off their plans, and Part B premiums have crossed $200 a month for the first time. These changes can affect your health, your finances, and your independence, and they can happen fast. I do not want you relying only on YouTube notifications to hear about this, because the algorithm does not always show you my videos when they go live. And sometimes by the time you see a video, the deadline to act has already passed. That is why I created something specifically for you. In the description below this video, you will find a link to join the Global Senior Alerts Official WhatsApp channel. When you join, you will be able to download a free senior benefits protection guide. It covers Social Security, Medicare, pensions, banking rules, insurance policies, and travel regulations, all in one place. and you will receive real-time alerts, not once a week, not whenever the algorithm decides, real-time. The moment a new rule or change is announced that affects your benefits, you will know about it. Click the link in the description, join the channel, download your free guide, and share this video with someone you love, your spouse, your neighbor, your friend from church, because right now, there are millions of seniors across this country who got a denial letter this month and are about to make the same mistake Margaret made. They are going to accept it. Help them fight back. I am Edward, and I will see you in the next one.